NaPro technology is really a way of assessing and treating those root cause issues by first understanding what's actually happening on a hormonal level with a woman's cycle.
Welcome to Straight Talk on Life Issues. I'm Victor Nieves, president of Life Issues Institute. Today we're going to be talking about a very interesting topic that is NaPro technology, also known as natural procreative technology. It's a women's health science that monitors and maintains a woman's reproductive and gynecological health. It provides medical and surgical treatments that cooperate completely with the reproductive system and honor the sanctity of human life. Today we have Dr. Gavin Puthoff to talk to us more about it. Dr. Gavin is the founder and medical director of Veritas Fertility and Surgery. He's a board-certified gynecologist, specializing in the treatment of infertility, endometriosis, miscarriage, and other gynecological conditions. He's trained in surgical NaPro technology, a form of advanced reproductive surgery. Well, Dr. Puthoff, thank you so much for joining us today.
Yeah, thanks so much for having me. This is a great opportunity.
So for our listener out there who may not be familiar with NaPro technology, it's very exciting. I don't want to try and explain it to them. You're the man to give the explanation. Tell us about what NaPro tech really is.
So, NaPro technology is a way of seeing women's health and fertility that was developed by Dr. Thomas Hilgers back in the late 70s, early 80s. And interestingly, it actually started as charting with what's called the Creighton Model Fertility Care System. And when women are trained and sort of educated on how best to chart their cycles, the Creighton model system is a very standardized method of tracking various biomarkers during the cycle, their bleeding patterns, their cervical mucus pattern. And so what Dr. Hilger sort of accidentally found out was when we're actually monitoring the cycle with that level of specificity, you start to pick up all the abnormal aspects that can show up in a woman's chart. I always will tell our patients that their Creighton model chart actually becomes the diagnostic foundation for everything that we do with our restorative reproductive medicine approach to gynecologic health and fertility. So NaPro technology is really a way of assessing and treating those root cause issues by first understanding what's actually happening on a hormonal level with a woman's cycle.
And so in layman's terms, this is about fertility. This is about fixing the underlying issues that might be preventing a woman from conceiving a child.
Correct. Right. So it's both gynecologic health and fertility or infertility. And we say fertility in both ways, right? So we want obviously to support the fertility of a couple. And sometimes couples will choose at various times of their life to say, we're going to observe our fertility, understand our fertility for, health purposes, but also maybe to space children. Of course, in our practice, our focus really is assessing and treating those underlying issues of infertility that are causing infertility. And I think that's a big difference with NaPro technology as well, is that NaPro technology, the way we see infertility is it's not a disease. It is the symptom of other underlying conditions that cause the infertility. So oftentimes we hear, infertility is this condition, it's this disease, it just has to be treated with IVF or artificial insemination. And that's sort of like a back out approach. It really is, it doesn't force you to look for those other underlying issues. So with NaPro technology, just even simply our verbiage and understanding of infertility as the symptom of those underlying conditions, it kind of compels us then to be more investigative and to look at those deeper underlying problems that we can address, both to help improve the woman's health, but also to improve fertility. So a big focus of what we do is we want to assess in a very comprehensive way what each individual woman or each individual couple's issues might be so that we can offer them those very specific and targeted treatments.
And so is NaPro technology relatively new? I only ask because it seems for so long IVF to so many has kind of been the default. If there's a fertility issue, people just naturally assume that that's what they have to do. Is this a little bit newer, or why might it be that more people aren't aware of NaPro technology and treating this as the go-to
Yeah, it's a
answer?
good question. So it is not new. Like I said, Dr. Hilgers developed NaPro technology in the 80s and then actually published a textbook in the early 2000s called Medical and Surgical NaPro Technology. We call it the Big Black Book because it's huge. And Dr. Hilgers, in the process of developing NaPro, really understood that there was a huge void. And a big part of his impetus to develop this was out of Humanae Vitae with Pope Paul VI, or St. Paul VI now, calling on men and women of science to better understand the cycle and to better understand fertility. And so that was, a call that Dr. Hildreth felt strongly to pursue. And in so doing, he developed NaPro technology. Now, obviously, in the 80s and the early 90s, we had very limited access to broadcasting and websites, but Dr. Hildreth would do interviews and he would, obviously train other physicians to understand what NaPro technology is. So it grew as sort of a very organic, in some ways, process where doctors who wanted to offer something else other than, well, I just don't do birth control pills, or I'm a Catholic doctor, so I don't do X, Y, or Z. But here's actually the proactive stance that we can take from a Catholic perspective to better treat our couples with dignity and understanding of their underlying, their worth and the dignity of marriage. So I think it's definitely been growing, of course. And really in the last several years, we've seen it take hold in a much different way, I believe, because of this sort of move in our culture toward let's try to be healthier. Let's try to understand what those root issues are. Restorative reproductive medicine, I think, is becoming more prominent and more understood as this is a more appropriate, or this is more healthy way to address gynecologic concerns and to address infertility. And I would say that that's one of the main complaints that we hear is, why did I not hear about this 10 years ago, when I was going through these issues? And IVF truly as an industry has so much financial backing, and there's so much that's poured into the pharmaceutical industry and the what we call big fertility industry that it is hard to keep up and it's hard to sort of get our voice out there. But I think as more and more couples and women are learning about what we offer with NaPro technology and restorative reproductive medicine, it's going to continue to spread as it has been. So to answer the question again, it is not new, but it's just, I think, becoming more newly understood on the more broad scale, which I think is fantastic for patients.
It does seem, in my anecdotal experience, that there is definitely a rise in people who are, especially younger people who are in that health-minded space, who are now talking about this as an option. Let's talk about the big question, the elephant in the room that people are probably wondering. How's the success rate? Is this working well for people? Are they happy with it? And then, we know, we'll get into this, I suppose, we know IVF is notoriously quite expensive. So for somebody who might be thinking about this, what can you tell us about that?
So in terms of a success rate, it's always difficult to say exactly what it is for any particular condition. We are currently finishing out a 10-year database of my patients since I've been in practice for over 10 years to actually be able to give that answer of, if you have stage 2 endometriosis and a blocked fallopian tube, this is what we would expect as your success rate. But in general, what we will see is somewhere between 60 to 80% success rates in terms of overall chances of achieving a pregnancy. And that's fantastic. I mean, that is very, very good in terms of the outcome for our patients. So many of our patients are coming to us after 3, 4, 5, 8 years of infertility, and we're still seeing those types of success rates in the 60 to 80% range. IVF success rates are measured slightly differently. They're generally measured on a cycle-to-cycle basis. And in general, most of the cycles will have about a 30% success rate. It really depends a lot on certain factors like the woman's age. And as you get, into your early 40s, those success rates drop down to 20 or even less than that per cycle. So cumulatively, IVF success, if one could afford and tolerate the psychological stress and emotional stress of going through multiple cycles of IVF, the cumulative success rate for IVF generally settles out right about 60%. So we're still seeing success rates truly that are better than that. Now, it's not that you'll get pregnant next month necessarily with NaPro technology, because we're actually treating those underlying conditions, and that's going to take some time, and that's going to take a process of understanding what's going on with the cycle and what's going on with fertility. But here's the other really important thing I think to note, which is very different from IVF, is with NaPro technology, because we're treating chronic disease states or chronic issues, we are not just achieving a pregnancy once, but actually allowing for couples to have ongoing recurring fertility, quite to the point of we actually have patients who will come back and they'll see us after pregnancy and say, well, I had X, Y, or Z condition prior to, I had to get that treated. Do I have to do anything different for number 2? And oftentimes it's very little intervention that's needed for that second or third or fourth child. Or we won't even have the patient come back, and they'll just be sending us their Christmas card, and we'll see that they've got 4 kids on those Christmas cards now, when we had only treated them before their first child. So that's really the goal, is with NaPro technology, if we can treat those other underlying issues, that we're allowing for ongoing fertility compared to IVF, which was, going to have to be used every single time that you'd want to get pregnant.
Talk about an incredible blessing. And, just as a complete layman in this, Dr. Puthoff, it would seem, logically speaking, that when you look at IVF, if there are these underlying issues that could be chronic illness, a couple of things that you've described, if IVF is not addressing those issues, that seems in a way like putting a band-aid over a bullet hole. That doesn't seem to be actually helping the woman. That seems to be one of the most compelling parts of NaPro technology is it's getting, my understanding here from what you're saying is it's getting to the actual root of the issue.
Yeah, and I think that's definitely one of the things that we hear from couples who've been through the IVF process is not only is it expensive and sort of burdensome from a emotional and psychological standpoint, oftentimes when women will go through the IVF process, whether they achieve a pregnancy or not, they get this gut sense that they don't actually care about my health. I tried to bring up my symptoms. I tried to bring up this other issue. And the response almost invariably is, it doesn't matter why you aren't able to get pregnant because we have this thing called IVF and we can just circumvent those issues. And what does that mean to a patient who's going in to have everybody wants to know the why. They want to understand, why can we not achieve a pregnancy as a couple? What's going on here? And for the answer to be, it doesn't matter, we're just going to circumvent this problem completely. That's not why we go to physicians. We want to go to the doctor to become pregnant, sure, but we also want to become healthier, more knowledgeable about our health and to help to support our health. And you do not get that through the IVF process, unfortunately, because exactly what you said, now we're allowing pregnancies to occur potentially in a state of an underlying inflammatory state, hormone deficient state, chronic diseases like issues with the uterus or the fallopian tubes or the pelvic tissues like endometriosis. That's not going to be as healthy of a pregnancy. And that's actually shown in the data that IVF pregnancies are not as healthy as pregnancies that are occurred spontaneously.
And that's not an issue then with NaPro technology.
Right, because we're always helping to support the natural fertility of our couples. We want to be able to fix those issues, optimize their overall health, and thereby now they're achieving a pregnancy in a state of health. We always say healthy mom, healthy pregnancy, healthy baby. That's the goal of what we want. And who wouldn't want that? And that's the issue, is that a lot of couples just don't even know that's an option. They just assume, okay, if I'm not getting pregnant with my OBGYN, doing a couple cycles of Clomid, for example, I'm going to be whisked off to the IVF clinic. And guess what they're going to recommend is after a couple of cycles of IUI or artificial insemination, it's off to IVF. And that's basically the one size fits all approach to that method of treating infertility. And I think that's a big part of it also, is that the treatments that we offer with NaPro technology, they're complicated. They involve a lot more investigation from our perspective. They involve more buy-in from our patients. We actually ask our patients to participate in this process in a very different way. We're not subjecting them to treatment after treatment or cycle after cycle of IVF, for example. I think that's also a positive because our patients now feel engaged in their care. You would not believe the types of questions, very, very educated, questions that we get from our patients about little nuances, because once they start to get into this, it starts to open up all these other different aspects of, well, what about my nutrition? What about my health? What about inflammatory issues or stressors in my life? What else can I do to take this to the next level of encouraging, improved health and fertility?
And what are some of those areas where you see women regularly have not just improved fertility? Obviously, that's kind of the whole point here, but also their health at large, because these underlying health issues, those need to be addressed as well. What are some of those areas that you've seen people's lives change in their overall health and wellness?
Yeah, obviously that is the goal, right? Well, obviously the end goal for a lot of our patients who are seeking us out for care, they're trying to achieve a pregnancy, yes, but they also want to become healthier. So, I was talking about the Creighton model charting earlier. On the Creighton chart, we can pick up so many issues, whether it's bleeding abnormalities or heavy cycles or limited cervical mucus or abnormal spotting before the cycle starts, just based on that. When we start to run timed blood tests and timed ultrasounds that are specifically targeting their cycle, because not everybody ovulates on day 14, not everybody has a 28-day cycle, we start to pick up very important but subtle aspects of ovulations not happening correctly. We're just forming a cyst every month, or the hormone levels after an ovulation are deficient. Let's help to support that. So it's pretty fascinating actually to watch our patients. This is kind of routine to us, right? But to watch our patients say, wait a second, all of those things about my cycle just because I charted for a month or two. And it's outstanding because obviously then we can help to support their own fertility, their natural fertility cycle. So that's sort of on the most basic level. When we start to talk about more complicated conditions or more inflammatory conditions, we think of things like uterine issues like fibroids or scar tissue in the uterus, inflammation inside the uterine lining called chronic endometritis, something that many couples who have infertility will suffer with and struggle with. Things like endometriosis, pelvic scar tissue, polycystic ovaries, adenomyosis. When you take those next steps steps to identify and treat those other underlying issues, you start to find out that, wow, this particular patient, this particular couple has so many things that we can help to optimize for them. For our patients, for example, who have endometriosis, when we treat endometriosis, and truly it is a surgically treated condition in most cases, right? So we offer this laparoscopic surgery or robotic surgery to address endometriosis. The way that we treat it is to actually excise all of those implants of disease. So endometriosis, I guess I should step back and say, is a condition where the cells that should have just stayed inside the uterine lining are now in the pelvic tissues. And they create a lot of inflammation and they can cause a significant amount of pain in addition to infertility. Well, so we're treating it, yes, for infertility, but also guess what? Our patients don't have heavier, painful cycles usually after surgery. Almost all of our patients will notice a substantial change, a substantial improvement in the amount of cramping or pain or heaviness of their cycle. And they're so excited to finally feel like, wow, somebody actually cared enough to take care of this condition in a way that provides me a long-term relief of this pain that I just thought I was going to have to suffer with every single cycle for the rest of my life.
And in a way that, as I understand it, if they would have just been ushered to IVF, they'd still be dealing with these issues. We love a good story. And as we hear this, I can imagine over the years of having done this, you have no doubt accumulated many wonderful stories of families that have just got these incredible testimonials. When you think about your work and helping women and families, what are some of those that stand out to you?
I think there's two. I think one is, when we have patients who come in to see us who have been told by other clinics, IVF clinics, this is not going to happen without IVF. You have to do IVF. You're never going to get pregnant on your own. It's almost like it's thrown onto the patient like they have something to prove. They want to show that the IVF clinic, yeah, you know what? I don't think that's right. I actually am going to go seek out a second opinion. And so I think the ones that stand out for sure are those patients who've been through the other process with IVF clinics, haven't gotten answers, haven't gotten the issues addressed, and they've basically been told, your ovaries are done. You've got to do donor egg IVF. That's the only way you're ever going to get pregnant. And then we offer them this restorative approach to their fertility where we treat those other underlying issues. Just within the last few weeks, we've had a patient who had 8.5 years of infertility, who now is pregnant just 2 months after her surgery. So when we actually treat those issues, wow, that's amazing what the body can actually do on its own once you address these other underlying issues. So that's one. I certainly think that those who have been through the other process with IVF clinics, who felt very defeated, who felt like the approach didn't address their why, the why that they had in their hearts about why can we not achieve a pregnancy. And then they come over to this side of things and see a completely different approach. It's very, very refreshing, I think. The other one is couples who've had multiple miscarriages and multiple loss. And I think this is very difficult and challenging in a very different way from infertility because they're getting pregnant, but they're so guarded at that point after they've had 2, 3, 4, 5 losses. And those are very complicated scenarios because there's often many times multiple conditions that can cause miscarriages. And it's a very thorough and deep investigation to understand what those issues are. And our approaches are different than a standard IVF approach, which again would just say, well, we're just going to try to do IVF and hopefully it works out this time. So I can recall multiple patients who've had something as simple as a uterine septum. It's an abnormality that's developed in the uterus. It occurred from birth. The uterus just didn't form correctly, but it comes with a very, very high risk of having miscarriages. And the treatment is straightforward. And after we take out the septum surgically, these patients can go on and have healthy pregnancies. And it's such a straightforward treatment in our eyes that why would every couple not be given this opportunity to address these issues? So no, it's amazing. I mean, obviously, we really do truly feel blessed to be able to do the work that we do every day. It's hard work, but it's totally worth it when we get those calls from patients who tell us, hey, I'm pregnant and I never thought that this was going to be happening for us.
So for maybe the listener out there who's wondering, is this something that I should be pursuing? At what point, in your professional opinion, would you say it's time for a couple to start thinking about this as an option?
Well, it's never too early to start charting the cycle. And we always encourage couples to start charting even in advance of thinking that they might have a problem, like we're not getting pregnant or I have really heavy or abnormal cycles. The more you can chart your cycle, the more you learn about the cycle and the more quickly you can identify those issues that might be arising early on. So we always encourage couples to chart. There's various charting methods. Obviously, with NaPro technology, we prefer or really work well with the Creighton Model Fertility Care System. And there are practitioners across the country, actually across the world, who are trained in helping couples understand how to chart their cycle. So fertility care, for example, is somewhere where a woman could go to this website and find a practitioner in her area who could help her start to chart the cycle. So that's step one. Step two is obviously, if you have symptoms, whether that's we're not able to conceive after 6 to 12 months, or we're having really heavy cycles, or I'm in a lot of pain during periods or other times of the cycle, let those symptoms not just be sort of pushed off to the side or ignored, and know that you deserve answers and you can get those answers. So especially when symptoms start to arise, whether that symptom is infertility or the symptom is an abnormal cycle or abnormal pain, or heavy cycles, that's a good time to start, the evaluation. I think so oftentimes women are pretty tough and they'll tolerate a lot. I think if guys had cycles, we would wuss out and be looking for that painkiller or that doctor who's going to help us figure out things sooner. But, we hear couples or we hear women who've had 10 years of severe debilitating pain, and they might have gone to a couple of the doctors who said, "Oh, just go on the birth control pill. This is normal." That is not normal. A normal cycle should not be painful. Let me say that again because it's so important. I think so many women think it's normal to have severe cramps during periods. No, that is not normal. That's an evidence of some issue that's going on with the cycle. So that would be what I'd say is, if as soon as you start having symptoms, to reach out and obviously to find somebody who cares enough to not just throw the birth control pill at you.
And it seems, Doctor, again, anecdotally, it seems that our country and maybe the entire Western world, really, if you look at fertility rates in the West, they're not good. They're well below the 2.1 that we need. It seems anecdotally that there is a big issue and a rising issue with infertility in the United States. I'm sure there's a million different reasons as to why that would be. Does it seem to be the case in your professional experience, your anecdotal experience, that more and more people are struggling with this?
Certainly, I think that is the case. There's different arguments as far as why we might be seeing that. Certainly, in general, there's a tendency to delay childbearing. And so, more oftentimes young couples are pursuing careers or pursuing advanced education and maybe postponing when they're having children. And we know fertility drops year over year. So that's one aspect that's certainly there. In the same light, certain conditions in the absence of a pregnancy can get worse. So something like endometriosis, it might start when you're a teenager and it's indolent and it will slowly become worse over time, even in some cases unchecked or without symptoms. So if we're waiting until 30 or 32 to have kids instead of 22 or 25, those conditions can become worse over time. Certainly there's a lot that goes on in our life that is not helpful for fertility. Our diet, alcohol, inflammation, stress from work, stress from life, all of those things can continue to be an assault for natural fertility. And it's a challenge because obviously some of these things are very difficult to address. I think some things like diet, activity, exercise, weight, all of those things are within our reach to address and to pay attention to try to live a more healthy life in general, so it wouldn't be affecting fertility as much. But I think it would be a deep rabbit hole to go down all those issues with what happens with our food sources, what happens with our even water sources, what the hormones that are in our food, the hormones or those kinds of things that are in so much of what we take in. Obviously, that's affecting our fertility in many, many ways.
Dr. Puthoff, do you have many patients that come to you because they would prefer to do things in a more natural, holistic way, but also in a way that honors the sanctity of life? Is there a moral and ethical concern that you're seeing as it pertains to IVF that would lead people toward NaPro technology?
Yeah, certainly we see both. We see those patients who see us because they've been through IVF and they never want to do it again because it's so burdensome financially or psychologically, emotionally, physically. And so they're maybe coming at this from a non-religious perspective. They want a different approach. They want a more natural approach. Then you certainly have that contingent of women or couples who say, we don't want to put anything artificial in our body. We're trying to live a healthy life in all aspects of our life. And the same would go for their fertility care. Again, not necessarily a moral imperative or religious conviction to not pursue IVF, but just because they want something that's natural and that's going to be supportive of their overall natural approach to their life. And then certainly we have couples who come to us specifically because they do, as the church sees this, they do understand life begins at conception. And they would never want to pursue a treatment that would take that and circumvent that issue or even denigrate that issue. With IVF, multiple embryos have to be created for one to be able to survive and to implant. There's different estimates. Somewhere around 90% of embryos that are created are never born. And that obviously is hugely problematic when we think about each embryo that's created, that's a new life. And that life is now a commodity in a fertility clinic to be basically sold to the parents. And so, yeah, we have a lot of patients who they know that, they see that, and they want an approach that honors the dignity of life from the very moment of conception and honors the process that God created for fertility, for natural conception, the dignity of marriage. And that's beautiful. We see patients from all aspects of life, but certainly it's very renewing for us to see those patients who are coming approaching specifically with that conviction. And I would remind them, hey, this is great ethics, yes, and this is a wonderful way to help you conceive, but it's also great medicine. So you don't have to feel like you're taking a secondary or less effective approach just because you're honoring life in the moment of conception. Obviously, what we do is in alignment with God's plan for fertility, which also means that it should and could and will be very effective for couples who see us for that purpose.
Dr. Puthoff, I've heard on occasion people will describe your practice as a quote unquote alternative to IVF. I wish people would stop saying that because this seems to be what it ought to be. This is what should be, where it's natural, it's honoring the sanctity of life, it is truly healing to the woman who's involved rather than IVF. So, to someone who is looking to be pregnant, if you had one piece of advice for that woman, what would it be?
That's a great question. Obviously, here I am as a physician thinking about all those different issues or conditions that we see most commonly. But I think that the most basic is to understand the cycle and to understand what the biomarkers of the cycle, like cervical mucus or bleeding patterns, what they mean for fertility. Because actually, studies have shown that couples who chart their cycle will achieve pregnancy more quickly and with a higher degree of success than those who don't. So it's such a straightforward first step that I would be remiss to not say, chart your cycle, understand your fertility. And that becomes a very powerful stepping stone if there is an issue to be able to move on to the diagnosis and treatment. So yeah, I would say that from the very get-go is understand the cycle, understand fertility. The window of fertility lasts about 4 to 5 days in the context of good cervical mucus. So for example, if we have a patient who has just 1 day or half a day of quality, clear, stretchy, egg white type of cervical mucus, that's their fertile window. It's a very, very narrow window where it should be 4 or 5 days. So that's why the charting is so important for couples who are hoping to conceive.
Well, Dr. Puthoff, thank you so much for joining us. This has been a very interesting and eye-opening program for myself and for certainly all of our listeners.
Absolutely. Thank you so much. It's so great to get this information out to couples, especially those young couples who are looking to start their family and don't necessarily know if there's going to be an issue around the turn. And for couples to feel empowered by understanding that there is an approach that is respectful to the dignity of life that can help them achieve a pregnancy on their own, obviously the way that God designed this.
Today's program has been eye-opening for me, and I'm sure it has been for you as well. There's so many couples out there who unfortunately are struggling with the issues of infertility, and oftentimes they're ushered toward IVF as if it is the only option, ignoring, for one, the financial cost of it, but for two, and more importantly, the moral and ethical concerns about the way that IVF is handled, to know that there is a better way, not necessarily an alternative, but a better way to address health and fertility, and hopefully to allow some of these families to have those children. We know that children are a tremendous blessing, and to hear that NaPro technology honors the sanctity of all human life while also giving that chance to couples is such a blessing. If you want to learn more about it, visit our website, lifeissues.org, and be sure to tune in next week for another Straight Talk on Life Issues.